Millions are on a quest for a good night's sleep, including myself, navigating through a maze of medications, therapies, and supplements. But what really works and what are the risks involved? I want to go into the complex world of sleep aids, from prescription medication to supplements to over-the-counter medication, and I want to talk about the crucial role of neurotransmitters in all of that. I want to give you guys the information on how this all works in hopes that a better understanding can help you make better choices when it comes to your own sleep. The use of medication to aid sleep is a complex topic. We need to balance efficacy, safety, and the potential for dependence. At the same time, a lack of sleep can significantly impact your quality of life. It can increase healthcare costs, and it's also associated with various physical and mental disorders. While cognitive behavioral therapy is the preferred treatment modality, access issues and higher costs can make medication a more common alternative. When we're talking about safety and efficacy, it's crucial to differentiate between the various types of sleep medication. Older medications like benzodiazepines are limited by side effects and have a narrow therapeutic window. Newer hypnotics, however, have shown better safety profiles, longer-term efficacy, and then we also have non-benzodiazepine receptor agonists, which are termed non-BZRAs. And while these are safer compared to benzodiazepines, they can have side effects like dementia, serious injuries, and fractures. So I want to focus mostly on hypnotics and benzodiazepines as far as prescription medications go. These are the most commonly used medications for treating insomnia, particularly for issues like trouble falling asleep or maintaining sleep. To really understand what these drugs are doing, we first need to understand GABA. GABA stands for gamma aminobutyric acid, which is hopefully the last time I'm going to say that in this video. But GABA is an essential neurotransmitter in the brain. It plays a key role in regulating various neurological and psychological processes. And GABA is actually made from the amino acid glutamate. So, GABA is primarily known for its inhibitory function in the brain. It works by binding to GABA receptors on neurons, which leads to a decrease in the neuron's ability to generate an action potential. This inhibitory action helps regulate nerve cells' excitability throughout the nervous system. So what does that mean for sleep and even anxiety? GABA's inhibitory effects are particularly significant in managing sleep. By reducing that neuron excitability, GABA can induce relaxation, reduce stress, and promote sleep. This is why these medications, benzodiazepines, and certain hypnotics are used to enhance GABA activity and treat these conditions like anxiety and insomnia. GABA's activity is balanced with other neurotransmitters like glutamate. This balance is crucial for proper functioning of the nervous system, but disruptions in this balance can lead to various neurological and psychiatric issues. So to sum that all up and understand GABA, it's a crucial neurotransmitter that helps regulate brain activity. It plays a significant role in managing excitability, mood, and sleep. Its function is really integral to understanding how various medications for anxiety and sleep disorders work. We talked a little bit about glutamate, but glutamate is the precursor for GABA. Your nervous system uses glutamate to make GABA, therefore your glutamate levels directly influence your GABA levels. Even though these two amino acids perform opposing functions, a shortage or lack of glutamate in the system can lead to lower GABA levels, and an imbalance of one or the other can lead to a number of issues. A shortage of GABA relative to glutamate can result in hyperactive and asocial behavior, similar to symptoms of autism. Too much GABA relative to glutamate, on the other hand, can lead to depressive symptoms. So now that we understand those, let's talk about prescription medication and how they work on GABA. First, hypnotics. Hypnotics are a drug specifically designed to induce sleep. They usually work by acting on the pathways in the brain that regulate sleep and wakefulness. We're talking about GABA. These hypnotics tend to have minimal side effects compared to older hypnotics and are preferred for their safety profile. However, they do carry some risks, especially at higher doses. Things like the potential for next-day drowsiness, cognitive impairment, and idiosyncratic reactions, such as persistent daytime sleepiness or memory loss. Their primary therapeutic use is to induce sleep with minimal next-day sleepiness, but caution is really advised due to the risk of dependence and potential withdrawal symptoms. Then we have our benzodiazepines, another class of medications used for insomnia, and again, it works by enhancing the effect of the neurotransmitter GABA in the brain. Again, this leads to sedation, muscle relaxation, and reduced anxiety, which obviously makes them effective in inducing and maintaining sleep. Some common medications that I'm sure you've heard of are lorazepam, diazepam, and clonazepam. While these medications can be effective for short-term management of insomnia, they're generally not recommended for long-term use due to risks such as dependence, tolerance, and withdrawal symptoms. They're also associated with side effects of daytime drowsiness, cognitive impairment, and increased risk of falls, especially in older adults. So the decision to use benzodiazepines should be carefully considered. You need to really balance their benefits versus their risks and the potential for abuse. Both of these drugs are prescription drugs, and obviously you're going to be sitting down with your doctor to make these decisions. But I think it's important to help people understand what's really going on in the brain, what we're trying to effect with these drugs, any potential side effects, so you can make the best decision for yourself. Next, I want to jump into common supplements that are used for sleep aid. The big one here that everybody first thinks of is melatonin. Melatonin is actually a hormone that's produced by the pineal gland in your brain, so it's already something that we're making. Its production is stimulated by darkness and inhibited by light, so you can see why light plays such a crucial role in regulating the circadian rhythm, and that's how melatonin affects the sleep-wake cycle. It signals to the body that it's time to sleep, and it helps regulate the internal clock and promote that sleep onset. Melatonin supplements are widely available, and they're used to manage everything from sleep disorders to jet lag. And it can really be particularly effective in cases where you really need to adjust your sleep cycle to change your circadian rhythm, or if you have a circadian rhythm sleep disorder. Studies have shown that melatonin supplements can be effective in reducing the time it takes to fall asleep and may slightly increase the total sleep time. It's generally considered safe for short-term use with few side effects. However, long-term safety data is really limited. The biggest problem with melatonin is dosage and availability. Obviously, it's available over the counter in various forms, including pills, liquids, and chewables, but the dosage can vary wildly, and it's often much more than the body is producing on its own. So it's important to note that melatonin is not regulated by the FDA in the same way as prescription medications, so purity and potency can vary a ton between products. Even though melatonin is so readily available, I really tend to steer people in other directions when it comes to sleep aids, and it's still important to consult with a healthcare provider when you're thinking about taking melatonin. Next up, we have valerian. Valerian is an herb that's native to Europe and Asia, and its root is commonly used as natural remedy for sleep disorders and anxiety. It's been used for centuries for those exact effects. The exact mechanism of how valerian works is not fully understood, but again, it's believed to interact with that GABA system in the brain that we already talked about. It's thought that valerian might also inhibit the breakdown of GABA, which enhances its calming effects. Research on valerian's effectiveness for insomnia is really mixed. Some studies suggest it can improve sleep quality and reduce the time it takes to fall asleep, and the real benefit here is the side effects or potential side effects are pretty minimal. Things like headaches, dizziness, or an upset stomach. There's not a lot of long-term safety data available, but really the only thing we're worried about is its interactions with other medications. Valerian is again available in various forms, including capsules, tablets, and teas. The biggest thing with valerian is that consistency has been shown to increase its effects over time. Next up, we have apigenin. It's a naturally occurring flavonoid, and it's found in various plants like chamomile, celery, parsley, and fruits. It's gained a lot of interest recently for its potential benefits on sleep and anxiety. If you think of chamomile, which contains apigenin, it has been traditionally used as a sleep aid worldwide, with studies indicating its potential use in improving subjective sleep measures, especially in populations like menopausal women experiencing sleep disturbances due to hot flashes. It also has mild anxiolytic activity, which can contribute to its effectiveness as a sleep aid, particularly in individuals with insomnia or underlying anxiety disorders. Again, its sleep-inducing effects are believed to be due to a potential role in activating GABA receptors in the brain. By mimicking the action of GABA, it naturally aids in reducing anxiety and promoting sleep. Next, we have L-theanine. It's a compound that's found in tea leaves. L-theanine appears to enhance the production of alpha brainwaves, inducing a state of calm and mental clarity, which can be conducive to better sleep. The great thing about L-theanine is it's generally considered safe, and it's a naturally occurring amino acid, again predominantly found in tea leaves, specifically in green tea. And unlike other sleep aids, L-theanine promotes relaxation without causing drowsiness or sedation. Again, it operates by increasing the levels of calming brain chemicals like serotonin and GABA, and simultaneously reduces the levels of chemicals associated with stress and anxiety. This combination of increased relaxation and decreased stress make L-theanine a really popular choice for improving sleep quality and duration. Really, the only main side effect that L-theanine is well known for is making dreams more vivid and memorable. So if you struggle from night terrors or nightmares, this might be a supplement that you avoid. Magnesium threonate is another supplement that has been explored for its potential benefits in improving sleep. Magnesium is an essential mineral that plays a role in various bodily functions, including muscle and nerve function, and it has been linked with help in relaxation and sleep. Magnesium threonate is just a form of magnesium that is particularly effective in crossing the blood-brain barrier, and that makes it more effective in influencing brain functions related to sleep and relaxation. Again, magnesium threonate is effective by promoting GABA neurotransmitters in the brain. You can start to see a common theme here and why we thought it was important to really talk about what GABA is and understand that process. Finally, I just wanted to cover over-the-counter drugs like ZzzQuil and how those work and what they're doing in your body. ZzzQuil helps you fall asleep by introducing an ingredient, diphenhydramine HCl, into your system, which is an antihistamine. Antihistamines work by blocking histamine receptors in your brain, and histamine is a chemical that helps control alertness in the brain. It also blocks the effect of another neurotransmitter called acetylcholine. This neurotransmitter is vital for memory and learning, and there has actually been shown increased risk of dementia by 54% with the long-term use of antihistamines like diphenhydramine. Acetylcholine is responsible for carrying messages from your brain to your body through nerve cells. It is also an excitatory neurotransmitter, which means again that it excites the nerve cells and causes it to fire off those messages. I don't want to get into too much of what it does, but basically it plays a major role in voluntary muscle movement all over your body. So by blocking this neurotransmitter, diphenhydramine can relax and slow down those messages, creating a calming effect. Again, there has been shown a risk of increased dementia in patients with long-term use. Other long-term side effects are worsening of urinary retention or narrow angle glaucoma. So those are really the three categories of medications or supplements that are available for you to use as sleep aids. Hopefully this serves to give you a better understanding of all of the medication supplements that are available. And with that better understanding, you can make better and more decisions for yourself and for your own sleep.